medication video is to show you how to properly mix and draw up and inject a progesterone injection. With progesterone, why am I taking that? Probably is the biggest thing that we get asked first in the fertility clinics. And with progesterone, what you want to know is that's a key medication to helping the lining of the uterus be well supported and nourished while an embryo is looking to attach an implant for successful implantation. So medications that help that, progesterone being one of them, is used in your fertility cycle, and it's used to help in and around that embryo transfer so that your body has everything it needs in hopeful implantation for successful pregnancy. So that's the first thing you want to know about progesterone. The other thing to know is progesterone is administered into the buttock muscle. The reason sometimes with this medication that we often have patients ask about other areas, though, I was going to say, is that, we use the buttock muscle because it's a big non-weight bearing muscle. I think I do get asked a lot, can I use my quadriceps? Your quadriceps, and I'm standing here marching in place, if I had to lift up legs that were getting progesterone shots, it might be a little difficult to do that. So the idea is that you want it in a nice muscle that's great for absorption, but doesn't have weight bearing on it. And that's what those quadricep muscles have, is that they have to lift the leg. The other thing is the deltoid muscles, where we might get flu shots. Not a great muscle to use for a progesterone shot, simply because it's just too much for these little muscles to handle. And again, these hands and arms have to be raised up, and then you're using that muscle to do that, lifting, grabbing something, and it would just be way too much. So just to confirm that the location is always going to be the gluteal muscle. And the nurses at most of the clinics, even like ours, what we do is we try to do our best to help give you a circle on both sides of the buttock, the left and right. Because the thing to know about progesterone is usually you are on it for several days, sometimes it even can be a couple weeks. And the reason for that is in early pregnancy, it's what's helping keep that lining well supported, again, where that pregnancy is growing until we have a placenta that takes over, which is the mom-baby connection. So that's its key importance, and why you might be on it a little longer than some of the other ones is because that little phase takes a little while for that placenta to fully function. So the progesterone in oil is an injection that it's intramuscular in the buttock. It is used to help support the lining for hopeful pregnancy and nourish and give everything that embryo could need to have a successful implantation. And it is also something that typically we would recommend that you have somebody administer to you. I'm not going to say I haven't ever helped somebody who had to do their own injection, but when it comes to muscle shots, if you have somebody that can inject and give you the shot, it just takes a little bit of that pressure off. The one thing I will mention is sometimes patients want little hints or help with this shot because they might have heard things about it. First thing I would say, as far as storage goes, it's really important that your vials of progesterone do not get refrigerated. So one of the things I will mention about that is when you get that nice big box from your pharmacy, possibly Mandell's, don't be afraid of it. Okay, guys, you have to open that box because human hands packed it. So you want to take that packing slip out and you want to just look to see quantity of what they've sent. That's really what a packing slip is, just like if we ordered something from Amazon. So what you want to know is it's really a good idea to open up that box, take a peek at it, see that you've got everything that it says has been sent to you, and hold off. You don't have to look through everything right away. But one of the things that I would say, particularly with progesterone, is that typically it's in an oil base. So oftentimes it's very important that it just maintains at a room temperature. So feel free to contact us if you have any other further questions, and contact your pharmacy when you do receive this medication. But definitely get it out of the box and leave it on that counter, or leave it in a safe shelf where nobody will get at it. One of the other things I'll just mention is at our clinic, we're okay with letting you use the old tried and true, a little bit of ice to the area. And you're not over icing when you administer for this. You're just going to give a little ice to the area before the injection, and that helps just numb it so that you don't feel any pinch of the needle going in. So ice everybody has available to them at their home. So just know that that's one of the things that I will talk about again, but just to let you know that you can use prior to administering in that glute muscle is to apply a little bit of ice. And we'll also talk about another product that I'll be just showing you here, is just to let you know that there are Cinera patches, which are also helpful sometimes for people that sometimes have difficulty with getting blood drawn, and they've gotten a lot of anticipation based on that. It is a numbing type of cream patch that you put on to the area. So we'll talk about that later, but I just want to let you know there's some other options that you can talk to your clinic and to your nurse about in case you're having troubles with those injections. So with the progesterone, the next thing that we need to know are the supplies. And so once again, our little list here is for progesterone, we need 1 vial of progesterone in oil, and oftentimes it might come in a box that'll say right on there, progesterone. You will need 1 3cc milliliter syringe, and there may be definitely a needle attached to that. So keep that handy. You'll need that 1 syringe, and that needle that's usually attached is this 122 gauge inch injection needle. That's usually what is already attached to that. If your syringe comes separately without a needle attached, you would need the 3cc 3 ml syringe, and separately a little package of a 22 gauge 1.5 inch or 1 inch needle. Most often, most of us need a 1.5 inch needle, but there are times that some patients are rather petite, and we can order a little bit smaller needle for them that'll still get into their muscle. But most of us technically need that 1.5 inch to get to muscle. And then 1 18 gauge pink needle. It's usually pink in color, a little pink on the label here. It might be hard to see that in color, but just to let you know, it's a pink needle. I want you to know that that is a big needle that looks like a nail. Never, ever, ever would we ever want you to have to do that as an injection needle. So just know if you see that when you open that box from your pharmacy, please do not panic. That pink needle is simply to help draw up the medication. And it makes it a lot easier when something's thicker in that vial, a little bit thicker oil substance, helping you draw it up from that vial is really easier with the pink needle, but then you discard that pink needle. Never, never, never do you need to have an injection with that. You just don't want to put that into the muscle, okay? So always, always, always ask if you're ever concerned and you just saw that needle and you forgot, what the heck is that for? And you're panicking that has to be administered into your muscle. It does not. So it goes into the bottle only. So with all of our medications, as I mentioned, it is not a sterile technique to mix or administer medications, but it's always a clean one. So what you want to do is have nice clean hands after you get your supply. So you can clean with soap and water, or you can take a little bit of hand sanitizer and sanitize your hands before you are going to work with that medication and prepare it for injection. So with our bottle of progesterone, there'll be a plastic cap that we snap off. Okay, under there, what you want to know is it usually is sterile after you open it the first time, but this is what we call a multi-dose vial. You are going to use the contents of this vial potentially until it's empty. So because of that, each and every time you want to clean the top with a little alcohol. And if you get these little prep pads, you can use them. The other thing I would say to that is if you don't have prep pads, a regular bottle of alcohol, isopropyl alcohol with cotton balls will do. So you don't have to have these little prep pads. If you don't, it's okay. But most of the pharmacies, and I know the pharmacy Mandell's, they do supply this to their customers. So I just want you to know that they will probably be in there for you to utilize. Once you clean the top off, the next step is to take the needle and syringe that may be coming together, or if it's just a syringe, whichever, you need just the syringe to start. So what I always do is, this is in a little sterile package, and when you open it up, you can hold your hand on the needle, pull back the packaging, and just twist off the syringe. And you can leave that needle in there safely. That's our injection needle, so we'll leave it in there until we're ready for it. And then what we're going to do is we're going to take the pink needle, open it up from its package, and we're going to twist that gently on to the syringe. Don't over tighten, because remember, we're going to remove that needle, so we don't want to have it where we can't get it off. So you want to gently tighten it, and that big pink needle is what we're ready to go, and it draw up a dose of medication that we need to administer. Typically what I'll show you is a typical dose is 50 milligrams, which in terms of a liquid amount is a milliliter, 1 milliliter, or 1 cubic centimeter. So a cc and an ml is the same. That's the other thing, that a lot of us nurses have different lingo with that. So some nurses will say take 1 cc, and the patient may have been hearing from another nurse that said 1 ml. So a milliliter is equivalent to a cubic centimeter. So 1 cc is equivalent to 1 ml. Probably a good side note to know that, because we all do have our own little lingo, and I don't want that to throw you off. So I'm going to draw up some air. And the reason I always just do that is because there always can be a little pressure in the vial. So however much liquid you're going to take from that vial, you inject that much air. So you draw down and line up the rim of that plunger to that number 1. If you're doing a dosage of 1 ml, 1 cc, if you're doing anything more than that, your clinic is going to let you know that. So you'll always be following your directions of your clinic. And then what we do is we insert that needle straight into that vial. We push up on the bottle and inject a little bit of that air, and then we draw down and fill up to the 1 ml. With this one, you don't often find that you'll have bubbles because it's not a water base. Being an oil base, there might be a little less bubbles in there. So sometimes you might hear about air and having to flick out any air. Not typical that you're going to have to do that with this medication, okay? So you can remove the needle. The bottle, you will use it again until this bottle's empty. So remember, multi-dose bottle. Put it away. When you need it for the next injection, when you take it out, you clean the top off. You don't have to cover the top, but you're always going to clean with alcohol before you poke a needle through it, okay? So multi-dose vials are good because you don't have to use many different items and supplies. You want to then safely cap this needle. The pink needle is going to come off, and then I'm going to discard that in my sharps container. You'll have a red sharps container from your pharmacy typically to keep safe all of your needle tips and all of your syringes. And then what we're going to do is take the injection needle and now twist that on gently to get ready to administer. So now we have our medication and our injection needle ready to go. A little hint, some people do, I've taught this many years, so it's no right or wrong, just some little tips you could do. If you'd like to, you can roll this syringe in your hand. Because it's an oil base, sometimes people hear that, what can I do to kind of help with that injection when it goes into the muscle? And what can I do to help it absorb or break down into the muscle? So because this is a little bit of a thicker solution, you know, certainly that's the reason why it takes a little bit longer to have it break down. So one of the little tricks could be this rolling, because just the friction and the heat from your hand can do that. I know some clinics might even actually recommend that you could take your tap water, run warm tap water, and the needle's covered that's sterile, and you can run it over a little bit of warm tap water to just, again, once again, do what you can to sort of, it's to make it a little less thick when you go to give that injection, okay? So those are just some little tips that you can try to see if they help you, and I hope that they can, with this injection, help you. The other thing that is a little tip that I know we do at our clinic is, I'll just get my mannequin. This is an injection that's going to go now into the muscle area. Pardon me, she's losing her undies or underwear. This is, the side here is open to show that the red is the muscle. That's why we need a longer needle, because we need to get into that muscle. And all of us have a little pinching of fat. So the yellow is fatty tissue, the red is the muscle, and that's the sciatic nerve. But the nice thing is when your clinics and the nurses there are marking you, which a lot of times all the clinics do that, they are marking the appropriate area that you're going to need in your gluteus muscle. So what you want to know is we're marking what's called the upper outer quadrant of the buttocks to administer that shot, so you don't even have to worry about that sciatic nerve, because you know where we're usually marking you is going to be free and clear of any of that. Keep in mind that when you get this injection, the administration of the needle is something that we'll talk about. You might feel a little pinch if you don't ice the area, or if you don't use one of the Sonera patches, which helps to sort of numb it. If you don't do either of those, then you would feel a pinch with the needle. You might feel a little bit of pressure when the fluid goes in, but it's very fleeting because you're not putting in a lot of fluid or a lot of medication. Really, with muscle shots, it's the next day. And any of us that have had flu shots or anything, vaccines in our arms at times, you know that your arm feels a little heavy or a little just tired. Or when you work out at the gym and your glutes are a little sore, that's really what you should potentially feel after a muscle shot. There should never be redness, warm to touch, itching, swelling, severe pain. And if there is, always, always contact your center and speak to your center's, your nurse and or your team, because they would want to know about that. Because we don't want you to feel as though that is a normal symptom that we should feel after we administer these shots. A little soreness, and you should be able to rub at the glute with your hand, but anything more than that, definitely that's something that you can report to your nurse in your clinic. The other little thing that I'll mention about after the injection that's a good idea is gentle massage. Some people even use the foam rollers from their exercising to sort of roll over the area a little bit. If you have a handheld massager that's got some heat, that's great. A little bit of warm, moist heat. These are all things that are just comforting to the muscle, and it just helps. So what you'll find with this injection when we do have to administer is the nurses will hopefully have helped you with where to give it and have circled that area. And usually we put circles on both sides, and we do it in Sharpie pen, and you can retrace it because it'll fade a little bit in the shower, but it usually doesn't ever go fully away unless you really are rubbing at it to, you know, with soapy water and such. So it'll fade a little bit, but you can retrace. And you want to move the injection around each evening to a different side. You would want to alternate right, left, left, right, and within that circle, moving the injection around, just so that it gets to all of the muscle and it's not so difficult that it's having a difficult time breaking down, okay? With this medication, as I mentioned, it is intramuscular in this glute, so it is recommended if somebody could administer the shot to you. If you want to, you could stand for the injection. If you stand for the injection, if somebody was administering into my right glute, what I would do is I would stand and put all my weight on the left side, and I would just lightly touch down my right leg. What I'm trying to accomplish with that, if I stand, is I want a relaxed muscle. So that's one way you can do it if you'd like to stand. If you don't want to stand, then what you could do, if I were administering and this was a real person here that I would be administrating, her front of her body would be facing you, and the back here where I need to administer is facing me, and I would administer. She's laying down, so her muscle is already relaxed. So key thing with progesterone shot is a nice relaxed muscle, so that just it's nice and easy going in. And again, if you're using a Sonera patch or a little ice, if you do any icing, we always do recommend, though, do not over ice. There's no reason for that. You could just do a couple minutes on your timer on your phone, and that'll numb the surface so that you don't feel the pinch. A little bit of the soreness that you feel, what helps with that really is warm, moist heat, gentle massage, even, like I said, walking around, activating that muscle, but you'll feel it a little bit, but it's not excruciating, and it should never be that you can't sit, walk, sleep, etc. It should never interfere with daily activity. That's important. And if it is, then please notify your clinic's nurse team, okay? So if I'm ready to do my progesterone shot and I have the area and I've iced it already and I'm giving this to someone, I'm going to take my cotton ball with alcohol and I'm going to clean that whole little area. My next step is going to be to uncap my needle. I know this looks a little scary. What I want to say to you is literally the little tip is what's sharp. We don't really, when we're given a shot, we don't sense how deep it is. We sense when it went in. So if that helps you to kind of understand that, I understand completely by looking at the size of the needle, but I want to help to relay that it's the tip when it goes in will feel like a pinch, like when you get your blood drawn, okay? With this one, we do not need to pinch and gather the skin. We actually are going to keep our hands away from that area so we don't get hit, but you could open up, do a little L with your hand and wrap it around. Remember, I would be behind this person if they were standing, and if she's laying down, I would have her on her side, and I could be sitting. But in this little video here, I kind of have the angle of this needle going in at roughly a 45-degree angle. The needle going into the body in my hand is in a 45-degree angle. It is not pointed the needle down to the floor, and it's not parallel to the floor. It's roughly 45 degree. No jabbing. That's not necessary to trauma the skin. Place the needle to the skin and give it a little gentle push. The needle goes all the way in, because that's a question I always get asked, and it needs to go in to get into the muscle. What you then do is take your hand that was wrapped around the hip and hold that needle in place, and you're going to pull back gently on the plunger. When you pull back gently, what you're looking to not see is any blood enter the syringe. And I want to let you know that it's very rare to happen. I think in my 26 nursing year career, I've maybe hit once or twice where I gave a shot and it even hit a vessel or a little vein. It's okay. If it does go in and you notice it and the blood enters here, not a problem. You haven't injected anything yet. However, what you want to do is remove the needle. What we have you do is remove the needle completely, change the needle tip. You can use the medication because it's going into the same person, and go to the other side and reattempt to administer. It'd be highly unlikely to have that happen a second time, okay, just to reassure you of that. But if you pull back and you do see blood, just stop, think of a stop sign, remove the needle completely. You'd put a little cotton ball there, put a little Band-Aid if you need to, and then go to the other side, but change the needle tip, because the needle only goes into the body once and comes out once. It doesn't go back and forth and in several times. So when you pull back, what you're mostly going to see is nothing. There's no change in the color of this liquid, because oftentimes you're in that good spot that's been marked for you. And then you just gently push, and it's going to take a few seconds with the progesterone because it's a little bit thicker, but you push it all the way in. You can do a little 1, 2, 3, and then you remove the needle in the same angle as you inserted it, gently from the skin. You remove it, set it down. Don't panic if you see a little oil coming out or a little blood. Put pressure and hold that cotton ball there for 10 seconds. Here's where some people like to put Band-Aids on, some other people don't. All I will say about Band-Aids is don't leave them on in the morning all day until you do your next shot the next day or anything like that, because you will get rashes from some of those Band-Aids even if you don't have a latex allergy. So put the Band-Aid on if you're getting dressed and you just don't want to soil your clothing, but at some point take it off, kind of like we do with our arm. We don't walk around with that, you know, gauze and Band-Aid there. It's just there to pressure to help that bleeding stop, but this is not even going in a vein. This is going in muscle, so it'll stop pretty quickly, okay? And then remember, with progesterone, that you can find out from your clinic what they would like you to do, if they would like to add in a Sonera patch that we'll be talking about at some point on the videos here, or just want you to use a little bit of ice. But post-injection, the key to that is just a little moist heat, a little warmth, a little gentle massage. But the ice really can help with the pinch. And the nurses marking the area, I think, gives you a lot more confidence in knowing where it is that you need to go. Okay? So remember this. This is a shot that when you're taking this for several weeks, you have a nice pregnancy. So the whole goal of your fertility cycle is now manifesting, and when you're doing those injections, a lot of people don't want to get off the shots because they're concerned about doing that for their pregnancy, but you don't have to worry. When you come off those shots, it's a nice reprieve, but you've been doing them and you have a good reason to be doing them. So best of luck with you. I hope these tips help you with the mixing and the administration of progesterone.